everyone, I'm Molly Lindquist, part of the Manta Cares team, and I want to welcome you to our Patient from Hell podcast club. The purpose of the Patient from Hell PCORI episodes, funded by the Patient-Centered Outcomes Research Institute, is to bring PCORI-funded researchers onto the podcast to share about their research so more of us can learn and use it to help us in our own lives as patients or care partners. And the podcast club gives us the opportunity to chat with members of our community to get their thoughts on each episode. Today, I'm super excited to chat with Laura Carfang, co-founder and CEO of our nonprofit partner, survivingbreastcancer.org. SBC was created in 2017 to help fill the gaps in breast cancer support, education, and resources. We're going to speak with Laura about her personal experience with breast cancer, the work that SBC does, as well as get some of her thoughts on episode 58 of the Patient from Hell podcast, The Complexity of Breast Density and Breast Cancer Imaging, featuring Dr. Karen Wernli. Laura, thank you so much for being here, and I'd love to just start with a little bit about your experience with breast cancer.
Yeah, no, thank you for having me. Excited to be part of this podcast club. I love, that's got a great ring to it too, like the podcast club. So very happy to be here. My story of breast cancer, it seems like it happened yesterday. It's hard to believe at the time of this recording. I'm like 7 years out from my diagnosis, which is wild to think about. But I was diagnosed at the age of 34 with no family history of breast cancer. And I was a strict vegan for the longest time. I became a vegetarian at the age of 16 because, I think when you're a teenager, you need a cause, right? And so I was like, I'm going to be a vegetarian. And then that shortly accelerated into living a vegan lifestyle for a number of years. And so I share that because I thought I was living a very healthy life. I was eating very well. I was lots of fruits, vegetables, legumes. I was in great shape. I was working out. I enjoyed hiking and biking and living an active lifestyle. So I was not even considered high risk for any of these types of breast cancer or really anything. I would go to the doctors, blood work came back fine. Everything was always really good. And so in my opinion, I thought I was quote unquote doing everything right. So when I found out that I had breast cancer, it was a complete shock because I was like, oh my God, vegans can get breast cancer too. I feel like you get cancer and people are like, oh, you should eat some wild mushrooms, or do you have more broccoli? Did you know kale cures cancer? And I'm like, I'm doing all these things, right? You read the magazines of how, blueberries can help fight inflammation, or tomatoes help with all of the heart and stuff. And I'm like, I eat all these really good things. How am I so sick? How did I get cancer? So I just kind of sharing that cancer is one of those things that does not discriminate. Even if you don't have a high risk for developing it, it can still happen. Being 34 years old, I also never had a mammogram before. I was never being screened for breast cancer. So a lot of this was kind of brought upon myself, noticing that what are the symptoms of breast cancer, I guess. I mean, it's interesting. I don't mean to sound naive, but I didn't really know the symptoms of breast cancer or all of the various types of symptoms of breast cancer. I think a lot of times you talk about doing a self-breast exam, you feel for a lump, but there are so many other factors that can present, such as dimpling or secretion or pain, redness, etc. And so I didn't know any of those things. No one was coming to me, talking to me when I was in high school or in college about understanding breast health. And outside of my annual physicals, I wasn't really paying attention to it much. In hindsight, I did have a misdiagnosis, if you will, at the age of 32. So I did feel a lump underneath my armpit, and I just always assumed that has been there. It could have been ingrown hair from shaving. It could have been all of these things. And because, in my opinion, knowing my body, it was quote unquote always there. It was just always there. It wasn't something new to me. But after being diagnosed with breast cancer, we did find out that I did have lymph node involvement, and that lump that I felt under my armpit, was a positive malignant node that I had. So wild story, being in your 30s, not really familiar with breast cancer or really any cancers, going to my first mammogram, which was a diagnostic mammogram, and immediately being squeezed into a lunchtime appointment for an ultrasound and ultimately a biopsy. So that's when things were like, oh, like you're squeezing me in during your lunch break for this. Things are getting a little serious. And I remember them having me sign the consent forms, of course, for the needle biopsy. And the doctor was telling me that, one of the risks, as they always tell you, all the risks, is getting a collapsed lung. And I'm like, I don't even know what a collapsed lung is. I've been healthy. Like all my blood work has been great. Like now you're telling me that I need a biopsy. I don't know what a biopsy is. This needle looks horrifying. And now you're telling me that like I could potentially have a collapsed lung. Like I was not coming in today for all of this information. It's very emotional. But we went through all the process, and obviously, like, you get your results, 7 days, 2 weeks later. I was in the oncologist's office very shortly thereafter, doing the workup for all sorts of other types of imaging, including a breast MRI and an MRI-led biopsy. I'm not sure if that's the technical term, but something along those lines, where they put you in this very uncomfortable, like, superwoman pose and poke and prod you. Very uncomfortable, feels a little dehumanizing. And you're just not sure what's going on. What are they looking for? And again, not being like familiar, not having gone through cancer before, they also did a full body scan. So again, because there was lymph node involvement, they wanted to see if there was progression to other parts of my body. I was not thinking that when they did the whole body scan. Like they literally like make you lay at a table. They like wrap you up in all these blankets so you like don't move for 30 minutes. It's very claustrophobic. I don't recommend it. But at the same time too, I wasn't sure like what they were looking for. It was just test after test after test. Drinking contrast fluid, getting CT scans, and just waiting for more information to become available. In hindsight, I was like, wow, I think had I known they were looking for metastasis or other parts of like spread to my bones, I would have been much more scared going into these tests. But I think I was just so like young and naive and not knowing what I didn't know that I was just like, okay, I guess I have all these doctor's appointments now. Like this is like the new thing. So no surprise, it came back positive. For early stage breast cancer, I was diagnosed with early stage 2B, triple positive breast cancer. And because I was triple positive, I started off with aggressive chemotherapy, followed by surgery and then radiation. I did not have a complete response to the chemotherapy, so then I had another bout of chemotherapy thereafter. And then I was on hormonal therapies for the last 7 years. So, yeah, all the good stuff. Like, wow, had no idea this could happen. And it's like a crash course in science and biology and in cancer.
Oh my goodness. Wow, Laura. And through all of this, you go through all of this, where did the idea for survivingbreastcancer.org kind of start for you? What gaps were you kind of trying to address? I'm always interested to hear, how these personal experiences really start showing up in all these different places in our lives.
Yeah, thanks for asking. I never thought I would run a nonprofit. I did not go to school for nonprofit management. It's amazing to, run survivingbreastcancer.org. Similarly, host my own podcast, Breast Cancer Conversations, and really help and support so many people who have been touched by breast cancer. So it's been wild. But I remember how the idea started. And like so many of us, it's like, okay, I'm going to go back to work. I'm going to go back to the day job. But my perspective has totally changed. Like my priorities have totally changed, and what I want to do with my life, how I want to leave my legacy, how I want to help others, really became like at the forefront, right? Like when you're diagnosed with a cancer diagnosis, you're like kind of confronting death, regardless of what stage you're in. You're like this, you kind of stops you in your tracks. And so my parents were out visiting, and I'm in Boston. I was getting treated in Boston, and they rented an Airbnb. I have to share that because, places in Boston are small. I could not host them at my house, but they rented an Airbnb, and they came out for my surgery, and just to be like an extra set of hands and everything for the weeks thereafter. We're sitting at their Airbnb, and we're all kind of like, now what? Like, what next? I had FMLA. I was taking some time off to recover. but then it was like, what next? And this idea of starting a nonprofit got presented, and I was like, let's try that. Let's figure that out. Let's see if that's something we wanted to do. I'm always up for a challenge. I love learning new things. So why not take a crash course and how to start a nonprofit and fill out all of this crazy paperwork to submit to become an official 501c3. If anyone wants to write a dissertation, this is a great foray into all of that paperwork. But during my treatment, and let me back up just like a little bit as well, but during my treatment, I documented everything on YouTube. So I know a lot of people start blogs or, Caring Bridge or other ways of like writing and communicating with family members and friends to keep people updated. But I knew that video is just going to be easier for me, especially if you're fatigued or tired. I wouldn't be able to keep up on like the typing or the writing of the blog. So I did all of my updates over YouTube on a public YouTube channel. And it was through the raw dialogue of like, today I'm shaving my head, I'm losing my hair, today I'm getting my port placed, I'm starting my first infusion, tonight's the night before my surgery, I just got home from surgery, this is what the drains look like. From just documenting that experience online, I was already building a community of people who were responding and engaging with me and interested in my story. And so taking some of this content that I was already producing and making this more of a formal process in the terms of launching survivingbreastcancer.org, it was this idea of how can I provide personal patient experiences, mirror that with a medical advisory board to make sure that our content is vetted and accurate, and providing resources in a variety of modalities, whether that's reading a blog, watching a video, listening to a podcast, or attending a virtual program, meeting the patients where they are and giving them the emotional support to help them manage a cancer diagnosis.
Wow, that's amazing. And so you've been around since 2017. What has been kind of the most surprising or maybe the most meaningful, thing that's happened in that particular part of your experience?
Every day. I mean, I'll tell anyone, like, and I don't know if this happens with Manta Cares as well, but I remember when I launched survivingbreastcancer.org, I bought the domain, I bought the email, and then I got my like first couple of emails, and all of the emails are like, I just got diagnosed. What do I do? I just got diagnosed with breast cancer. Please help. And again, being a little naive and whatever, like, I guess I wasn't expecting. I mean, of course I'm expecting that, but like, the trauma, I guess, of like every single time I open my inbox, I hear someone's story and immediately make that connection, and this friend and this person who is looking for help and support. And then that has really been my fuel for why we do what we do year after year. And I know, Molly, you know this, but for your listeners, like, I work a full-time day job. I do not take a penny from the money that we bring in from survivingbreastcancer.org. All of our funding goes directly to the programs and the services that we provide. And people are like, how do you do this? How do you have a full-time day job and then come home every night and then work on SBC? And it is because of that passion. Like, I come home at 6:00 and I'm tired and I have dinner, but then I open up that email, I start working on a program, I start facilitating a support group. And every night at like 8:30, 9:00, I'm like, wow, like, I'm making a difference in people's lives. And that is just like, I'm energized by it. By the time I'm going to bed, I am like so fulfilled. And I want to do more, and there's more work to be done. And so I also joke that, that the gods are out there and somehow we get funding. But, every year it's like, are we going to have enough funding to sustain ourselves as a nonprofit? And somehow year after year we do. It's like, I'm going all in. This will be the last year. Like, I'm just going all in. And then by December 31st, something happens and we can have another year of funding. So, I think someone out there is looking out for us and appreciates the work that we're doing. And we hope to continue to, put this good work forward.
It's amazing. Oh my gosh. So just to transition to podcast, did you have a chance to listen to Dr. Wernli's episode about?
I did. Yes.
Anything jump out at you as particularly interesting or surprising?
Well, I love the series. So like, just having a doctor on the podcast to kind of ask questions too. I think the format was, asking some questions and getting some like professional medical advice on like what is the screening process, the mammography process. Why do some people get mammography versus an ultrasound versus an MRI? And in which cases are these being utilized? I also think the timeliness of the podcast was pertinent because a lot of legislation is recently changing around being able to notify women of their breast density. So, a couple years ago, not every state had the obligation to even let women know that they had dense tissue. And dense tissue is a leading potential indicator for breast cancer. So why would you not want to know that? It also impacts the quality of the x-ray that you're getting. And so again, why would you not want to know that and advocate for yourself for other types of modalities? So, it's wonderful now that we're in a situation in 2024 at the time of this recording that now all states are required to notify women of their density. But now the work still, again, is not done. Like now that you know that, what do you do about that? And really being able to not just advocate for yourself. I think more change has to happen at like, the insurance level, the payer level, the, even partnering with your doctors to get them to write the prescription for the MRI even, et cetera. So, I think it was a really timely conversation, and then understanding like the research that's going in behind this and understanding, how many more lives can we save if we're using the right methodology to detect breast cancer.
Yeah, that makes complete sense. I think something you said in the beginning that really resonated with me as, a fellow survivor is, you kind of get dropped into cancer land and you really don't know what you don't know. And so, from your perspective, I'm so grateful for the work that you're doing to really help, even just spread the word about these type of changes in terms of legislation, in terms of, how do you prepare, what questions do you ask your doctor? I mean, I did not know, any sort of, that you have that emotional shock because you just received this life-changing diagnosis. And then coupled with that, I speak for myself and say I didn't have a ton of knowledge about cancer other than, just generally over the years hearing things. And so really being able to dig in and understand, okay, what's my situation? And, what do I need to do, to your point, to advocate for myself, to make sure that, I'm kind of getting what I need through the process. So I think, again, survivingbreastcancer.org, finding communities of people who, have been there and can at least help, anchor you in those early days of like, where am I? What do I do? I think is so,
Exactly.
so, thank you so much for the work that you're doing and for really channeling your experience. I think it's one of those things where, there are people that go through breast cancer and want to be done with it. And I so get that. It's, it's one of those points in the road of life that, most of us would much rather not go down, but to take that, and to channel that into a way to help others and really, again, to alleviate, some of that fear, I think is so incredible. And you inspire me, Laura. So thank you so much for all the work you do. And thank you for being a part of the podcast club and for sharing your story. And we're grateful for your insights. It's been a pleasure chatting with you.
Well, my pleasure to be here. Thank you for having me.